So, studying psychology in college is definitely different than the traditional biology, chemistry, human anatomy majors, things like that. And part of it is I did it to set myself apart when I was applying to dental school. But also, part of it was just that when I took those psychology classes, it really sparked something inside of me that was kind of always there, but it put some definitions and it put some reality around things that I've been observing my whole life. And so that really piqued my interest. And allowed me to then connect the dots with human behavior, how that can be interwoven into dentistry, whether that be positive or negative, and the ability to be a better listener to my patients is a huge reason why I think psychology was a great major to choose in the long run. So, being in public health dentistry taught me a lot that dental school, sure, it touched on it, but it never really gave me that real life reality. Seeing pictures that they showed us in dental school on the screen with patients that have a lot of dental cavities, missing teeth, ill fitting appliances, things like that, bad dental anxiety that has come across from traumatic experiences from other dentists, unfortunately. And so, in reality, when I saw that firsthand and seeing the lack of education that's out there, the access to dental care is difficult. So, some people had never seen a dentist, which, growing up where I did, I was very privileged to have all of that and to have that education and seeing firsthand what that can do when it's missing was very, very impactful and really changed the way I practice now, which obviously dental anxiety, it's nothing to me. I can absolutely help ease that because I've seen the worst of the worst. And so, of course, we have sedation dentistry, which can help ease that. And then, of course, our spa services that help to kind of get the mind off of, I'm at the dentist. So, relationship based practice is what Northstar Dental was built upon over 50 years ago when it was started by Dr. Klaus. We still have patients that are from that era that talk about him in such a positive way. And being part of that legacy is super important to me because that's part of the reason why I wanted to get into the private practice sector is because I wanted to develop those relationships with not just one generation, but hopefully more to come, as well as their friends outside of the practice as well. When someone refers their friends and family to me or the practice, that just shows me that they trust us and that we're being good communicators in establishing that relationship. And so, being a relationship based practice stands on connection and trust. And if we don't have those things, then there's no relationship based practice. So we really, really strive at our tip top priority to make sure that those two things exist before anything else. I have seen a plethora of patients in the situation where they're shut down. They haven't been in 10 years, especially after COVID. Ironically, even though we were so focused on health, some people went one way extra healthy, need to make sure that I'm coming in regularly. And also, I've seen the opposite where, they want to stay closed off. They don't want to come in because of they're scared out there, right? Or it's been that long. They had been 3 years prior to COVID and then the shutdown and then being scared to come back. So we see a lot of patients that haven't been in years and years. And the first thing that I try to do automatically when I see them is saying, congratulations for making the hardest step. Now let's focus on getting you the smile that makes you comfortable and happy. Because ultimately, what happened in the past is the past. Focusing on what could be and the health that comes from that is really what we need to focus on. And we're here to help for that. Similar to when someone goes into a gym who hasn't been in a long time, there is a lot of intimidation there. So we totally understand that. And our job is to first and foremost break down that wall and ensure that, hey, you're in the right place and we're so happy that you're here. When a patient comes in with a lot of financial, emotional anxiety, feeling very overwhelming, the first thing I do is, establish that relationship and listen because just hearing their perspective, their history, what is bothering them, what isn't bothering them, if they have hopes and dreams and goals for their smile and their teeth, And starting there, then everything from there on can be modified, arranged in a certain order or timeline, within reason, of course. But we have financial options that we go through with patients to help make their dreams more feasible and achievable so that in any budget, we can get it there. So a lot of people do feel judged when they come to the dentist, whether it be waiting too long, not flossing. Right away, I want to tell them it's okay and that we're here to develop that program, that relationship going forward to help support them in their journey to oral health and that smile that they not only deserve, but are really desiring, because that's ultimately why they found us, how they found us, most likely, is because they've talked to other patients. They've talked to their friends and family, and we've made an impact on them, and they want that same thing. So, starting off with no judgment zone, you are here. That's the hardest step, and we're here to walk with you to that oral health. One thing I would like to reframe in people's minds about coming to the dentist is that negative, they're going to overtreat. They're going to do unnecessary treatment. First and foremost, at our practice at Northstar, we do not believe in unnecessary treatment. We believe in treatment options that can enhance and get you where you want to go. And so we believe that you should know those treatments and you should know the pros and cons around those treatments. And we're here to walk through that with you. Total transparency. And from a visual standpoint, from a financial standpoint, we use technology in order to enhance our communication with the patient, such as AI labeled x rays that can show the patient, hey, this isn't just a gray blob. Here's what a cavity looks like. Here's what infection looks like on an x ray potentially. And these are the tooth parts going from there. It helps to, especially for those detail oriented patients, which we always ask, do you want details? Do you want big picture? Some people get lost in the sauce with all the details. We're happy to zoom it out and give you a summary. And then we can always dive deeper if there's questions. But really, tailoring each person's treatment plan to their specific needs and desires, and then just displaying the options. We're not here to force any treatment on anyone. We're here to be a resource, to be that education so that they can make that informed decision for themselves.